Good afternoon, everybody. It's Dr. Mary again at Family First Chiropractic. I'm also the medical chair for Impacted Inc. And today I want to talk to you about our poster again. Previously, we talked about the physiological aspects of concussion. Today, we're going to talk about the vestibulo ocular or balance and vision center of the brain. Now, I know you can't see that clearly, but I'm going to tell you what each of those things says, and we're going to talk about how that might show up in your life if you've had an injury like this, or if you've had a whiplash injury. Again, a lot of times people don't understand that a concussion doesn't happen just when the head hits something, but if the body moves faster than the head can move, the neck will snap, and this sometimes causes a concussion. We see this a lot of times in sports, football, hockey, lacrosse. Very common we see those injuries in those situations. And people will think, well, they didn't really hit their head. I know they're uncomfortable, or maybe their neck was a little bit sore, but maybe they don't need checked. And actually they do. For that exact reason. And we will see commonly dizziness associated with this. We'll see an inability to focus or concentrate. We'll see eye movements causing headaches or irritability. So this vestibular region is really important. If the eyes can't track properly, reading is affected, and that means comprehension is affected. So we have kids who are very smart kids who are typically doing very well in class who are now suddenly not getting good grades. Because this is such a common event, about 83 to 87% of patients that actually have a concussion will have a balance issue or a vestibular issue. Because that's the case, we've actually invested in this piece of equipment. This is from Balance Tracks. This gives us the ability to put somebody on here and evaluate what their balance actually is. Do they have a normal center of pressure? Do they have the ability to adapt their positioning in certain leaning or eyes closed, eyes open positions? We're able to evaluate all of that. And like I said, because there's such a high percentage of patients that actually have balance issues with concussion, it's been really effective. It also is something that gives us the ability to compare it to healthy groups. So that particular software is matched both in age and sex for patients. So if I get a 15-year-old girl in here, her results will be matched to a normative database of over 20,000 patients that will show me what most 15-year-old girls are capable of, or a 45-year-old female, or a 6-year-old male. It really lets us see where that person is and where they should be. It also is effective in helping us understand what our return to play characteristics look like. In other words, if they can't do these tests, if their tests haven't improved, then they're probably not ready to go back out there, even though symptomatically they may be feeling well. Especially when it comes to a balance and a coordination issue, the part of your brain that controls your balance and coordination also controls your core musculature. So if we can't activate those things well, we're at risk. We're at risk because we don't turn as well, we don't see the field as well, we don't adapt to imbalance as well, and these all become critical if you're an athlete. If you're driving a car, even more so. So I hope this helps you understand another area of the brain that might be affected, and stay with us at Impacted Inc. We're going to continue to bring this type of information to you. And there will be other people in our group that will do the same. They're going to provide you with information relative to school, relative to teaching formats, relative to strategies at home for study, so that you can help your kids get through this, or if you yourself have been affected by something like this. So stay with us. Impacted Inc. will continue to bring you this information, and I hope this helps. Have a great day.